The anatomical terms of location are vital to understanding and using anatomy. They help to avoid any ambiguity that can arise when describing the location of structures. In this article, we shall look at the basic anatomical terms of location, and examples of their use within anatomy. Note that there are some anatomical terms that are specifically used in embryology. You will see them at the later parts of this video. Medial and lateral. Imagine a line in the sagittal plane, splitting the right and left halves evenly. This is the midline. Medial means towards the midline, lateral means away from the midline. Examples. The eye is lateral to the nose. The nose is medial to the ears. The brachial artery lies medial to the biceps tendon. Anterior and posterior. Anterior refers to the front, and posterior refers to the back. Putting this in context, the heart is posterior to the sternum because it lies behind it. Equally, the sternum is anterior to the heart because it lies in front of it. Examples. Pectoralis major lies anterior to pectoralis minor. The triceps are posterior to biceps brachii. The patella is located anteriorly in the lower limb. Superior and inferior. These terms refer to the vertical axis. Superior means higher, inferior means lower. The head is superior to the neck, the umbilicus is inferior to the sternum. Here we run into a small complication, and limbs are very mobile, and what is superior in one position is inferior in another. Therefore, in addition to the superior and inferior, we need another descriptive pair of terms. Examples. The nose is superior to the mouth. The lungs are superior to the liver. The appendix is, usually, inferior to the transverse colon. Proximal and distal. The terms proximal and distal are used in structures that are considered to have a beginning and an end, such as the upper limb, lower limb and blood vessels. They describe the position of a structure with reference to its origin. Proximal means closer to its origin, distal means further away. Examples. The wrist joint is distal to the elbow joint. The scaphoid lies in the proximal row of carpal bones. The knee joint is proximal to the ankle joint. The anatomical terms of location are vital to understanding and using anatomy. They help to avoid any ambiguity that can arise when describing the location of structures. There are some terms that are specifically used in the description of embryology, which have the potential to further complicate an already complex subject. In this part of the video, we shall look at the anatomical terms of location used in describing embryological anatomy. Cephalic and caudal. Cephalic refers to the head of the embryo, while caudal refers to the tail or inferior end. Cranial is often used instead of cephalic when describing a location of one structure relative to another. Examples. The vitelline duct lies caudally to the primitive brain. The foregut is cranial to the midgut. Ventral and dorsal. The term ventral refers to the anterior or front aspect of the embryo, while dorsal refers to the posterior or back. Examples. The gut tube lies ventrally to the spinal cord. The spinal cord is dorsal to the developing trachea. Neuroembryological terms. Rostral and caudal are only used to describe structures within the central nervous system, above the level of the spinal cord, e.g. brainstem, cerebrum and cerebellum. They are more commonly used in neuroanatomy, but can be applied to embryology. Rostral and caudal. Rostral is taken from the Latin word, rostrum, to mean towards the nose or beak. Rostral therefore refers to the anterior, front, aspect of the head. In this context, caudal refers to the posterior, back, of the head. Examples. The forebrain is rostral to the midbrain. The hindbrain is caudal to the midbrain. Ventral and dorsal. As described above, ventral and dorsal refer to the anterior and posterior aspects of the body respectively. However, in the context of the central nervous system, they have slightly different meanings. Ventral refers to the inferior region of the brain, while dorsal refers to the superior region, towards the scalp. Please subscribe for more videos like this. Thank you.